We did session is 1:30 to 3.
Yeah, that's right, yeah.
Just one second, Mr. People, I have to connect to the IT person. Hi, sorry, I accidentally started the recording.
Okay,
That was a mistake.
everything's fine.
Yeah,
It's okay.
and
Sweet.
listening is here, I'm just talking to him about the event.
Got it.
As soon as we finish, then we can connect him
Okay.
there, if that's okay.
Yeah, that's fine.
You're just gonna be walking around, right?
Something loudly just to get your attention. Every now and then.
And we're.
Nah, it wasn't mine. It wasn't my plan. That's how we'll look at it. Okay, I had thoughts about what was sent as the questions I'd be answering, and I gotta actually remember what was sent.
So, yeah.
Yvonne, can you hear us? Okay.
I'm
You want to knock it out right?
Yes, sorry, yes, I can hear you. Can you hear me?
Yep, we can hear you. And can you share your video?
Sure. Yeah, is this okay?
That's okay.
I might
everything-
find,
And do you have slides that you want to share as well?
should I also share the slides as well?
Just
Yes.
think of answers.
So just give me a second.
Yeah, no worries.
At least, all right, so let's see, so. You put the share out of the. That is my question.
Going to.
Okay. So it says that I can't share the screen now because someone else is sharing.
Got it. Hold on now.
Sort of behavioral. But anyways.
Yeah, exactly. I have a, yeah, minor.
I can't even see the name. You see? It should be, I think. I hope I'm in the right room.
This is Nuances, behavior change in urban sanitization.
Oh, sorry, I think I'm in the wrong room. Let me just join the right room. Apologies for that, yeah.
Not a problem.
Thank you. And there's one other presentation. This isn't the first one.
You're going first, no?
That one, yeah.
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 Yeah, there's no intro.
Where to click and go. The click and not general.
Actually, put these in there. The census.
That's right. And then when I'm doing the time.
Yeah.
I will be. We already have.
I'll do it. Okay, shall we make a start, everyone? Welcome, everyone. You've chosen well. This is the Nudges and Nuances session on urban behavior change. So I'm Andy Narracott from UNICEF HQ, water specialist in sanitation, and I will be your MC to move us along, keep us to time, and to just give a few opening remarks. The session objective is for everyone here in the room to learn about new approaches to urban behavior change for your own sanitation project. So please be honest at the end of this session, let us know if we succeeded and any takeaways that you might have from this. So do note down anything that you want to share at the end. In terms of agenda, just my quick introduction. We're then just going to do couple of presentations. Is that right? Yeah, we've got a couple of presentations, one from Sophie from the World Bank, Mike Needle, I will give introductions in a second. Mike Needle on the framework and applications of behavioral approaches in urban sanitation, and then share research priorities as well from Richard Drivelbus. Then we're going to have a panel, so note down your questions, keeping them brief, please. Then we have Q&A, and then panel discussion. We have some great people. I need to update that slide. But, someone instead of Exaudi Patel, we have another presenter who Sophie will introduce later, who will be moderating the session. And then we'll wrap up. So without any further ado, just as a intro, why are we talking about behaviors? So anyone remember these days when we just talked about infrastructure and we just talked about toilets and access to toilets and putting boreholes in the water, in the ground? Then they kept breaking down. So we then started talking about services. We need, it's not just infrastructure, but they need a whole business model behind it and an enabling environment. So then they went from services, but then to move that to scale, lots of services working in harmony, but they don't work in a vacuum. They work in a system. And lots of discussion about system in UNC. And within that system are lots of actors and factors. Actors are the stakeholders, the local government, the private sector, the regulator, and the factors are things like political economy, incentives, social norms, and things like that. So behaviors is a very key part of systems because we want to perhaps get those actors to do certain things and to behave in certain ways. So it has a very important part. And the way I like to think about behaviors is within this multi-barrier approach, that you have all of your nasty germs on the left-hand side, and you have people on the right, and you want to separate those somehow. Safely managed sanitation is about breaking those links to get from germs to host. So we have a number of barriers in the way. One of those are technical measures. So we install toilets to stop, so that waste can be safely contained. And we built, the trucks and treatment plants. But then there's also, they need to be functional. They need to have, there needs to be standard operating procedures and ways to use those like behaviors or using those pieces of infrastructure. Then you have behaviors, because you want people to have behave in certain ways, and healthy behaviors or hygienic behaviors when using toilets, and sanitation workers want to have healthy behavior, hygienic behaviors as well. And then finally you have regulation, which is about enforcing through legislation certain ways of being and acting by those service providers, by consumers, and all the rest. So we're talking specifically about behavior change as a critical part of safely managed sanitation. So we know about rural sanitation. It doesn't have the whole sanitation chain. You'll just see here that it's the toilet and the containment is typically in a rural setting. If toilet and latrines are not being emptied and they stay safely contained in the ground, then that's a rural situation. But in urban, you have so many more things involved to safely manage the waste. You have service providers, transport, you have treatment functions that need to be treated adequately to the correct standards and performance, and reuse as well to keep people safe. So it's not just users in the urban environment, but it's also service providers who have behaviors that need to be changed in some situations. So urban behavior change has a real role to play in the urban sense, hence why we're here today. So yeah, rural, urban, there you go. So now we're going to hear a couple of case studies. Who's first? Is it Michael? So Sophie's first. Sophie is going to give us, is a data specialist, consultant with the World Bank. Sophie is with the World Bank's Global Water Practice since 2016 and works on bringing data analysis, impact evaluation, and behavior change interventions to the World Bank operation. Then we have Mike Nilo, my colleague, wash specialist from UNICEF. He's a medical doctor and a public health practitioner, managing wash, health, and nutrition programs with a focus on systems strengthening, behavior change, and community engagement. And then we have Robert Dreibelbus, who's an associate professor from the London School of Hygiene and Tropical Medicine in UK, and his research focuses primarily on water sanitation and hygiene behaviors and the relationship between behaviors and health outcomes, and the design evaluation of behavior change interventions. So now we're going to have those three case studies, those three presentations, 2 case studies and the research priorities, and then we're going to move into a panel, which I will hand over to Sophie to moderate. But may I welcome Sophie up first to give her presentation. Thank you.
Hey, thank you very much. Okay, well, great. All right, so thanks everyone very much for coming today. It's great to be here and good to be able to talk to you about a framework that we've been developing with the World Bank and a case study application of that framework for using behavioural change in urban sanitation. So today I'm just going to go through a sort of gender, motivation, behavioural perspective, specifically applied to the case of Lusaka, and then future applications. So In terms of motivation, so we know that there've been a lot of behavioral change interventions in the wash space, but they've been kind of a lot of them focused on hand washing, rural sanitation, and urban is maybe an area where we haven't seen as much. And there's less known about what works and what doesn't work. So I come from a sort of impact evaluation background where we've done our best to, as far as possible, try and come up with trials where we try to really measure the impact of the interventions that we're working on. And the urban sanitation challenges are different in a number of ways. So this is what started this work. We had an initial effort to systematize this knowledge where we had a working paper on behavioral insights in infrastructure sectors. And then we also have tried to apply what's called a more nimble approach, which was first sort of coined by Dean Carlin, I think, in Yale and IPA, looking at rather than these sort of long-term impact evaluations where, as was mentioned on the panel this morning, you end up with results after 5 or 10 years when your intervention is long past. We're trying to incorporate these sort of short-term, quick, cheap, quick, low cost and easy trials to be able to produce results as you go along and course correct. So here is a sort of behavioral perspective that we're taking. We ordinarily think primarily about the customer behaviors or the end user behaviors when we think about behavioral change. But here we're trying to kind of zoom out a little bit and think a bit more about the fact that there are actually behaviors at all levels. We have behaviors from the service provider, things like how do we ensure that they conduct maintenance of the sewer network, or ensure that people who are doing the fecal sludge emptying actually deposit that waste in the treatment plant when there is a treatment plant available. And of course, at the policymaker level, there's also behavioral challenges, and there are competing priorities. How do we encourage policymakers to invest in sanitation? So what we came up with was this guidance note, which unfortunately I don't have here, but it is available online, and a few other publications I'll talk about at the end, which kind of came up with this simple 4-step process of incorporating a behavioral intervention into, primarily we're looking at World Bank operations, but it's also relevant for any other projects. So, the first step is obviously to understand the behavior that you're looking for, a kind of diagnosis, then designing the intervention and the evaluation in conjunction so that you can implement the two at the same time. And obviously considering these other factors, practical factors like timing, does it make sense to implement your evaluation at that time? Do you have the actors available who have the ownership over really taking this forward, and budget and scale, etc. So in the first sort of identify the behavior to be changed, we looked at these different factors. So we want to understand the broader project objectives. So this, in the context of a bank operation, this can be, like millions of dollars of investment. And within that, identify the behavioral aspects which we want to work on. So say 3 or 4 of the most salient challenges from a behavioral perspective, and then map out the user journey. So in this case study in Zambia, it was a $65 million operation starting in 2015. And although there was a large investment in the sewer network, despite sort of 7 months on after connection chambers were available for about 1,000 households, only about 23% of those households had signed up to connect, and an even smaller proportion having paid the connection fee. So we did a little quick kind of qualitative research revealing that there are a couple of barriers. One was around information on the process of how to connect, and another was sort of on payment amounts and schedules and mechanisms. So then the next question for us was how to frame this information in a way that could convince the customer. So we here just kind of mapped out the user journey in a way that sort of made sense. And here you can see that there are barriers along the way at different stages of the process. So once they hear about the sewer network, they might have status quo bias. Why should I bother to change? What's wrong with my existing system? Perceived social norms means, well, if my neighbors aren't doing it, then why should I? Decision to connect, hassle factors in the way could be, well, I have to go to the office and then I have to come back and then fill in some forms and then go again. So we wanted to work on these different types of barriers. So in the next stage where we design the intervention, we also look around at what other types of interventions are out there and what's already been done. There was, for example, one in Brazil conducted by Embed, which is a behavioral arm within the bank. that looked at payments and reminders for sewer connections as well. So the interventions that we came up with in this case, one was here on sort of 2 different types of leaflets that we distributed street by street according to a randomized evaluation. And we just tested these 2 different types of methods, one more around a legal obligation and the other around just kind of an encouragement design. And we also, on both of the leaflets, provided the same information on the step-by-step process, so people wouldn't be confused by how much they have to kind of come and go to the utility office, and also on the pricing, which wasn't really clear to people before. And on the second intervention, we also wanted to encourage the payments for the connections. So we were aware about this kind of inconvenience of the process. So we wanted to test, and we also thought maybe in some other international research, we noted that there have been efforts to use lotteries to motivate people to connect to, sorry, not to connect to the sewer network, but to engage in different health behaviors. So we conducted 2 interventions here. We helped the utility to set up a digital payment system using mobile money, and then we sent out 2 different types of messaging to the households. So one was kind of around the lottery type of message, like don't miss the chance to sign up, so that you can also you have the chance of winning this lottery at the same time as connecting to the network. And the control message was just around getting households to reminding them that they should pay for their connection. So at the same time, we then defined the evaluation, and this was how we rolled out the intervention for the leaflets. So you can see that some streets received the orange leaflet and some streets received the blue leaflet, and this was randomly kind of assigned based on sampling. Basically, the main lessons learned at the end of the intervention were on, firstly, obligation versus encouragement. So in this case, the obligation message was more effective, but that was to encourage sign up and not necessarily payment. So we're not saying that you should always just oblige people to engage in these behaviors. You still need to inform them, but it was still the most effective mechanism, and information along the way definitely helped. Interestingly, in the case of the lottery application, it was the opposite. So the reminders worked better than the lottery itself, which was also told us about the importance of being aware of the local context, because many of the households in that neighborhood were of a religious group that meant that gambling was definitely not encouraged. A third area was on trust and a catalytic environment. So part of the issue with the payment system was actually that some of the transactions were not successful because there was some digital issues with the payment system. So although that has now been improved and the system has been rolled out to also include on-site sanitation, has been much more successful. Oh, and I will say that now there are they've surpassed the target of 1,000 connections in the area that we have been working. But it's very important to set up that environment, and also on the importance of doing qualitative follow-up. So in the intervention the implementation of the intervention, you have to consider all of these different factors. This is especially important in the context of a well bank operation, where there are so many different moving pieces, and an evaluation is just a small component that you need to fit in amongst all of the other factors. So just have this listed here. And then I just wanted to kind of bring your attention to other future applications for behavioral approaches in urban sanitation. So these are a number of different questions, some of which we have partially addressed through different interventions that we are reviewing and also implementing from our own side. But some of these are areas which could definitely do with more attention. And these are the publications that I mentioned at the start. So this work was done in conjunction with George Joseph, Kashramni, Alejandra, Ruth, and Alona, and you're welcome to reach out to any of us for access to these, and they're also available online. So thank you.
We're going to go straight into presentations now, so make sure you're keeping your questions. Thank you.
Hello, everyone. Again, my name is Michael Nilo. I'm a water specialist based out in New York. I wasn't the one supposed to be presenting this. It's my colleague, PC Akbar. I mean, but you know, I just want to make sure I give him credit because he's the one that manages the program on citywide inclusive sanitation. And also, I'll be sharing 2 case studies, and these 2 case studies have nothing to do with language. Again, I'm presenting on behalf of my colleagues in Indonesia and my colleagues in Bangladesh. One of them is sitting right in front of me that we should have been making this presentation. But if there are any difficult questions on Indonesia, I will send you the paper. And if there are any difficult questions on Bangladesh, Adnan would be happy to answer. All right. So I just wanted to perhaps just start with after when we were developing our WASH strategy at UNICEF, which was from 2016 to 2030 as part of achieving the SDGs. One of the things that we saw were there were things that we did well, or we think we did well, and we wanted to continue learning in that space and continue to adopt. And there were things that we thought we could do better, and there were things that we thought we could move into new directions. So just to say that new directions was urban, and we didn't do a lot of urban, we did a lot of rural, and rural sanitation and hygiene were actually, CLTS and the like work stuff that we were doing in the past, which we kind of thought we knew what we were doing. And one of the questions that always kind of came up was like, can you apply some of these learnings on social behavior change and social norms in the context of safely managed sanitation in urban settings? So also, maybe some of you guys have been in some of our other presentations where we shared the game plan. I won't go into this, but it has a very strong kind of system focus, but all throughout the document, as Andy was sharing with the introduction component, there's also areas where social behavior change would be a useful tool across the board, not just if you're looking at a social ecological framework from household all the way up to the system structures. So why are we doing this? So like in the 6 principles to guide the country programming under this, there's, country level, citywide, focus on equity and inclusion, choose interventions that are consistent with UNICEF's comparative advantage. Okay. So why should we do, for example, tariffs when the bank is there to do it? Right? And make sure that whatever it is that we do, or we're doing it collaboratively with our partners. So one of the things that we decided to do a few years back was join the bandwagon citywide inclusive sanitation. And since then, we've been like co-funded with the Gates, with the Gates Foundation. We've been working in Bangladesh, India, Ethiopia, and other places. To also then figure out how we were going to be working in this space outside of the system strengthening space. So Indonesia was not part of this funded program, but it was part of the program trying to figure out how to go beyond ODF. So there was STBM has moved quite a lot, but there was still a lot of people who were not accessing safety managed sanitation. It was something that we wanted to promote. Only about 7.5% of the population was using safety managed, and the government of Indonesia had a target of 15% of at least doubling it by 2024. So we were supporting it in that sense. There was also, one of the things that we knew is we needed to kind of improve private sector engagement because there was no way that the resources within Indonesia is able to, from the government, would be able to fill that gap. So we actually engaged Nielsen to do a market assessment for us. I wouldn't go into the details of this just because we don't have a lot of time, but it did a pretty extensive analysis. I think it's available online. And I'll let you guys go into it. But basically, they did an assessment in 6 cities. It was both quantitative and qualitative. They did 700 plus household survey, mainly focusing on containment to pit emptying. And then 76 respondents were interviewed, masons, government counterparts, small contractors, and so on. And just to keep the main findings short, families were generally aware of the relationship between poor sanitation and health, but they had no idea what's beyond the toilet. The other thing that came up was, many of the things that people thought were septic tanks are called septic tanks or not septic tanks. And there was also a misconception that a good septic tank should never be empty. Yeah, because they're bottomless, of course. There was also kind of like limited experience with promoting urban sanitation. If there were any, they were quite limited in the messaging and challenges with area coverage and timing. So in short, because of the gaps were so huge with regards to just basic knowledge. So the other thing that they were finding out was even the service provider, it was these misconceptions were not only from households, they were also from service providers and the authorities. And this was done in 2020, and everybody remembers what happened in 2020. So things kind of started getting delayed. There were some things that were being implemented and others were not. One of the things that were building on an experience that we had in Indonesia called Tinja Tinja during the time where we were trying to promote STBM and ending open defecation. This new campaign was one. So that translates as if you're haunted by shit, it's time to check here. It's time to check and suck, I think is the right term. But basically it's time to check your septic tanks, whether they are septic tanks and empty the septic tanks. Because the main goal, so so this was happening, right? Which is kind of like the wash component of it. In our UNICEF structure, there's also people who do social behavior change. And the decision at the time, because it was quite, no one could do a lot of things, was a digital campaign. And there were two main messages to kind of keep things simple. It was, upgrade your septic tank, because one of the things that they found in the assessment are that materials are available, but none of the tanks were complying to Indonesian standards. Please use desludging services because some of your tanks do need to be involved. So how was that done? So they wanted to grab people's attention, so they did just like with Tinja. They did a lot of humor and satire, and they were basically creating these. There's this one video where there's a pool and there's like a shark ship that then starts to chase the family and stuff like. But basically, those like short clips of 15 seconds to 60 seconds were then ways to kind of get people to go into a web. So that's the awareness bit, and then go into a website where the website gave them information about monitoring and desludging, and then hopefully conversion, which gave them like phone numbers or where to contact desludging services and the like. So this was the website. You guys can go to it. It should be working. And then since the 1st of February 2022 to December 2022, that's kind of like the social media coverage. So it looks like there was a lot of views. Whether they made an actual difference, I have no idea. And I don't think my colleagues yet know either. This is kind of like fairly new. Again, this is not a research, this is implementation. So, and then more ideas that were not implemented during COVID also were put into place. And here are some of them. So everything that kind of does different aspects of behavior change in this setting. 1 minute? I have to do Bangladesh. All right, so the videos, you guys can have it there. I'll go a little bit faster. Just to say that Bangladesh was done quite differently. It was like, so it was citywide inclusive sanitation projects in Dhaka North City Corporation. So 3 cities basically. It was to establish a two-way communication channel between the authorities and the city dwellers, and particularly focusing on those more informal settlers. So there were public hearings that engaged them, rapid assessments, and then there was a design of a communication campaign strategy. This is all rather new. This was just last year. So there were 20 public hearings that were conducted in 3 city corporations, and about 60 to 70 participants each. The hearings were documented, analyzed, and then developed into methods and tools for rapid assessments. And the rapid assessments included literature review, 30 key informant interviews, and 24 focus group discussions. And it was targeting specifically, ethnic and indigenous minorities. And then there were looking at caste, urban slum areas. So it wasn't just like a generic across the cities. There was an intent to invite these specific groups into the public hearings and the FGDs. So highlights, most of the dwellers used pits and septic tanks that were connected to drains directly into water bodies. And the second most common practice was hand toilets, which is basically the majority were not safely managed, similar to India. And then the rare few that did used informal laborers for manual. The design was a communication strategy that had multiple things. Again, so far, just to say that only a couple of them have been implemented so far. This was just finished in March. So so far a social media campaign has been done. A trade fair has been conducted, and a political engagement has started. And there's plans to do a lot more. Okay, none of them have really been evaluated yet. And hopefully we can engage you guys somewhere along the line, and Adnan is there if you need to chase them down. There was one more slide that I tried to bring the 2 things together. So there's a wide range of social behavior change interventions that need to be done in these places, and overwhelmingly clear that even basic knowledge on what safely managed sanitation is, or even fecal sludge management, whether it's users or whether it's service providers, are completely blank. So if in CLTS everyone knew what a toilet was and they were supposed to use a toilet, and their main thing was trying to get everybody to use one, this one we're way farther behind. And the concepts are complex. The behaviors are complex to change as well. And on top of this, there's inconsistencies with regards to the availability of the services, and the behaviors of the regulators and enforcement, et cetera, et cetera. There's few or even no examples of how this really works and how it would work effectively. There's certainly need for us more tools and clearer interventions. Yeah, it also means it costs more because there's so many things that we need to monitor. So hopefully these are some things that we are able to tackle in the next few years and engage many researchers in this space. Yeah.
Thank you. Thank you, Richard. Next. You have your slide up.
Yeah. Oh, perfect. We're working. Thanks everyone. My name is Robert Dragolis. I'm with the London School of Hygiene and Tropical Medicine. I'm going to present a little overview of our current published literature base on urban sanitation. I wish I could say we've got a nice, neatly done lit review that we're going to be talking through, but this is very much a work in progress. And a real starting point here was a systematic review that was conducted in 2019, looking at WASH interventions specific to the urban environment. Now, we all know, so something finished in 2019 probably goes back to about 2017 in terms of the data points that are available. So we've got about 7-8 years of publications that we're missing from this. But just to note, as late as 2017, in this particular literature review, you don't have to be able to follow all of this. They were able to find 76 behavior change interventions on WASH, focusing on an urban environment, of which only 6 studies related to safe fecal disposal, which kind of became their catch-all term for anything related to taking feces and putting it into a latrine. So what we've done is we started leveraging this. We've built off this to try to kind of find what else has been published. There's been quite a bit on this. And again, this is an ongoing piece of work. So if some of you are out there and have a paper on urban sanitation behavior change, and it's not on the list I'm about to show you, we'll get to it. We're finding it right now. But where we are, so far, we've been able to identify about 6 more studies that are that meet inclusion, are kind of ongoing inclusion criteria. This is work we're doing as part of a larger set of research with the Foreign Wealth and Common Development, FCDO, in the UK. So what do we see? Just kind of looking at what we have right now. So with this, with the previous systematic review and our rapid literature review that we've kind of leveraged with that, a whole lot on shared latrine cleanliness and a lot on cleaning latrines. This is, I think, doing math in my head very quickly, 6 of the 12 studies, so half, I can do some math. So we've got about half of these studies that are really focusing on cleaning latrines. Another set of studies, hitting the wrong button, that are looking at fecal disposal, so just using the latrines that are there. Predominantly, this literature base that we've got is mostly from South Asia and Sub-Saharan Africa. We could only find 1 study so far that was looking at East Asia and 1 study that's looking at Latin America and the Caribbean. Now, again, this is a work in progress. We're going to be finding more. I will be shocked if proportions of all of these things change a lot. I think when it comes to urban sanitation, at least from a research perspective, what we've really tended to focus on in terms of kind of studied as a kind of published literature really is this latrine cleanliness. We have really focused almost exclusively on the end user and their specific behaviors around how they engage with their existing facilities. So in part of this, I did want to acknowledge another kind of research priorities. If I'm talking about gaps, let's make sure that we're pointing out other gaps people have identified. Ben Tidwell and all, through an event that happened right here at UNC, had 10 key learning priorities for shared sanitation, 5 of which I think are relevant to how we think about behavior change in urban context. Now, these are specific to shared sanitation, not urban sanitation in general, but some of the things that have been outlined through there are really understanding the key drivers for demand for improving the quality of shared sanitation. How can we assess kind of user and share the impact of quality on end user experiences? The most effective management strategies for different kinds of shared sanitation, feeding into kind of how do we maintain and keep these clean. And then I think this one, which is very long on the previous slide over here, just so you know why we're all doing this, it's about this big. So I can't see my slide right here. It is what combination and or sequencing of market-based approaches, financial products, regulatory and legal frameworks, and collective action / co-production is needed to drive sustainable improvements in shared sanitation quality. And how can we promote the prioritization of improving shared sanitation quality? I think this one is important because it's a long, complicated sentence, and there's a lot going on here. So clearly there's a big, important thought here, but it is leading to the fact that, I'll move 1 slide ahead because I think it makes this point better. Our behavioral interventions that we've done in sanitation in urban spaces, at least in the published literature, really do focus on the end user and sometimes their immediate context. So it's predominantly trying to change the behaviors of people using these sanitation facilities. Sometimes we will kind of engage with landlords or compound users, but we're forgetting, or we're kind of largely overlooking, these very complex urban systems in which this behavior is situated. How do we engage with? I was really great to see this kind of list of priorities that were put up in Sophie's slides about how do we get people to engage with utilities differently, about bill pay, about hooking themselves to these different things. There's so many complex systems in this urban environment, and we're largely ignoring them and focusing on that one end user and the work they are doing. Again, when it comes to the end user, we're doing a lot on cleaning and maintenance of these facilities. Most of the research that we're able to find is also focusing on shared sanitation facilities. We realize this is an important topic. In a lot of places, it's the only option for urban sanitation, given crowded environments, but it's not universal, and we need more understanding about some of these kind of more household level interventions and how do we get people to kind of engage across these complex urban environments. And we also see that most of the studies that we've seen rely very heavily on information, communication, and education, or ICE approaches. That's why kind of these approaches using social marketing and big shit monsters chasing people down the street. This is a very different way of approaching behavior change and getting people to kind of adopt the key behaviors. Talked about that one. So I'll go to this kind of final slide on our emerging synthesis here. Is we really are focusing on these very traditional behavior change outcomes: cleaning, sanitation, child feces disposal, getting people to use or adopt or build a latrine. But we've got so many complex behaviors that are necessary around sanitation, where we need to bring that behavioral science approach and that behavioral science perspective, not just behavioral science. I mean, pick your discipline. You solve complex problems. Let's solve some of the more complex problems here, where we're really trying to get at these very complicated urban sanitation system. Just some priorities, but I think Sophie had a much better list on hers, so go back to that one. Finally, we are still relying on relatively, this kind of, you put the slide after most things, we're relying on very short-term studies. And short-term outcomes. We don't necessarily have these kind of long-term follow-ups. And while it's great, we're using kind of adaptive approaches and quick trials, they still need to be part of a longer learning agenda. So we're getting quick things, but what does this mean a year, 2 years, 4 years down the line? And we're also not really using particularly robust study designs. Not a methodological purist. I don't think everything needs to be an RCT. And I do have a feeling if we kind of reframed our vocabulary, we'd find quite a bit in the engineering disciplines or the urban planning disciplines who are approaching some of these problems. We need to engage beyond our kind of very narrow set of ways we've been doing things. We also see kind of a lack of in-depth process evaluations around a lot of these interventions. We tend to focus on the outcome, not necessarily what happened and the extent to which interventions are being delivered in these complex environments in the ways we intend. This is really how we're going to solve these problems, is knowing, are we doing what we think we're doing, and is it resulting in the outcomes we want? And finally, just as a point, building off the session earlier today, we're really not considering the fact that there's a whole planet changing rapidly in front of us. I was going to say for better or worse, but I don't think there's better ways. It's going to happen. We're really not the kind of bringing in these ideas of resilient systems. How do we adapt our urban sanitation system to kind of the realities of the Anthropocene? So with that, I will stop. So thank you very much.
Hello. See. Okay, we have time for some questions. Let's see if this works. We can go around the room. We have a question. I don't have a mic.
That's okay, I can
There's people online that they might want to do
Yeah,
it.
maybe you can come.
Maybe you can walk up and speak into this one.
Take a second, I might try now.
This one. Yeah, that one works. This works. It's not working.
Thanks, Mike, Sophie, and Robert for the wonderful presentation. I just have one question. Being an implementing agency in behavior change, we often struggle to convince the government about impact of any behavior change activity. And what I'm really looking forward to from the three of you is a toolkit or a monitoring or impact evaluation kind of a guidebook toolkit that can be used to convince governments of this works. A mass media campaign of announcing jingles on the radio will not work, instead do this or do that. So is there, have you come across in your research or in your practice that can be helpful for other implementing partners like ourselves?
Thank you, Robert. If you could, for our online audience. Thank you for the question. We'll take this one, and then when we have the microphone, we'll go around and get support.
Great, thanks. A really fantastic question. I think when we think about changing institutions, it's another area where we tend to, I think we talk to anyone and we say, it's just knowledge, teaching things, that doesn't do anything. And then we go to a government partner and we try to teach them and educate them on all the benefits of this. And I think even that reframing of thinking of how do we change the behavior of these institutions, of these organizations, there's not great models for organizational behavior change. I think it's where a lot of kind of our approaches to this. So I don't have a toolkit, just it's a problem everybody's struggling with. So I mean, I think reframing how we're engaging with our government partners or with these institutional stakeholders and taking the same kind of nuanced approach to getting them to start changing their behaviors may be an area for future exploration as well. So
Thank you. Thank you, Robert. Do you have anything to add, Mike?
Yeah. Perhaps we need to look at tools outside the wash space, is what I'm going to say, because I think certainly health and others. We do have a toolkit for social behavior change that's done by our colleagues. It doesn't always, go well with some of our usual thinking, but I think if we open up ourselves to those kind of opportunities, where we're working more with people that might not be aware of the issues that we do with the sector. If you recall that one slide that I showed, it was like the wash people did their thing, and then the SBC people did their thing. I think that's part of the problem. I think like learning how to work together, which I think was a key message also coming from many of the discussions so far, I think is an important aspect. So, but there are tools like a social-ecological model, I think really works well. I've used it in nutrition and seen, positive change at policy level all the way down to the implementation level.
Thanks, Mike. So everyone, we're picking up the sound from this device over here. So if you can shout. Any more questions for World Bank, UNICEF, and London School? Now is your chance. Otherwise, move on to the panel. One here. Anyone else? Right.
I just had a quick question for Sophie and your presentation, only because I just didn't get a chance to let it fully sink in. I was wondering if you could just take a minute to describe the obligation versus kind of encouragement for that kind of measures and just a little bit more detail on the framing or the language that you use.
Yeah.
Do you want to speak it? So for everyone at the back, that was more information on the model that Sophie presented about obligations. And anyway,
yeah. So sorry, I always rush things. So basically, there was just two types of leave. That one was sort of emphasized that there was a legal there was a law that said that if you're within 62 meters of the sewer network, you have to connect, but it wasn't really being enforced. So it was telling people that this is your legal obligation to connect in the one. And then the other one, we emphasized a bit more on the health benefits, the environmental benefits, the fact that it's good for your community, and even that it can increase your house price. So we told people all of these different messages, and we did those two things like in comparative terms. But then in the rest of the leaflet, we gave them the exact same information on, in order to connect, this is what you do, and this is how much it will cost. So we were just kind of enabling that. So we were hoping, obviously, as you do, that the encouragement design would be the most effective. It wasn't, but that doesn't mean that you shouldn't also encourage people by telling them the other benefits of connecting. So, yeah.
Thanks, Sophie.
Oh.
There was one more question.
Oh, yeah. Well, how many times do you use
Sorry, I can't hear you.
You mentioned you use posters.
Beyond posters, any other channels that you use?
Yeah, so actually, Lusungu, who will be coming on the panel in a minute, will, he can maybe address that a little bit because he's from Lusaka Water. They also went door to door with these leaflets and they kind of distributed them, but they also had kind of community engagement. I can't remember if they also had TV, but I think he can address those. There are multiple channels and I'm happy to connect you to later if you want to talk about that. Thanks.
Please thank our speakers, everyone. Okay, now I'm going to introduce the panel. These panelists do come up. So first of all, we have Ben Tidwell, Senior Technical Advisor with World Vision. Ben supports 42 countries with WASH programs. He brings learning and implementation together through implementing research approaches to promote dissemination of best practices. Thank you, Ben. We have Kondwani Chitsi. So I'm sorry, I nearly got it. That's good, man.
Yeah.
He's an environmental health practitioner with Washington Center at the Malawi University of Business and Applied Science. Previously, Kondwani was working with government and international NGOs in WASH program implementation, and his research focuses on WASH behavior change. Genevieve Kelly, from Program Director with Partnership for Better Living with SATO. Genevieve has 10 years experience in strategy design, implementation, documentation of innovative approaches in WASH product and service delivery in emerging markets, with a focus on market-based sanitation. Welcome, Genevieve. And finally, online, Lusungu Nairenda, sanitation specialist with Lusaka Water and Sanitation Company in Zambia. Lusungu, can you hear us?
Yes, I can hear you.
Very excellent. We can hear you as well. If you could put your camera on. And then we'll be able to see you on the screen. There you are. I'm just bringing you up now. Excellent. Welcome, Lusungu. So now I'm going to hand it over to Sophie, who you all know, to moderate the session. Over to you, Sophie.
Okay, so thank you all panelists for joining, especially Lusungu, who I called in at the very last minute because I thought his addition would be very valuable in this panel. So I'm just going to start with all of you to sort of ask you to tell us a little bit about what specific urban sanitation related behaviours that you're trying to address in your respective roles, and any ways in which you're addressing them. So who wants to go first? Maybe I shouldn't do that way. Okay, Ben, would you like to go?
Sure. Yeah. Yeah. Thank you very much. So my name is Ben Tidwell. As I think this doesn't work, so we can feel better, have good pictures. Okay. Well, I won't. I'll try not to scream directly in that. Yeah. So as mentioned, I work for World Vision. So a lot of what we think about is trying to do rapidly adaptable contextual behavior change approaches, because we support a lot of national offices that are focused primarily on implementation. So we do focus, or certainly I've focused in the past primarily on user behavior, on looking at interface rather than these sort of downstream behaviors. We're generally sort of technology agnostic, which probably will be a bit different than at least one of my other panelists. But we use essentially what we call a rapid BCD toolkit. So behavior-centered design, developed out of London School of Hygiene, is a process for design and evaluation of behavioral interventions. We essentially develop behavior evidence summaries for particular behaviors that fit into this, so that our offices don't have to start from square one. They can start with sort of a summary of the literature, take their knowledge, the local context, and rapidly adapt it into programs they can test. I will say, though, that as we've started to think about more of these complex challenges, we've realized that focusing on users alone is certainly not all that should be done, or maybe even the priority. I think honestly, it's because it's easier. It's if you think about what could we change in a short period of time, thinking about this larger scale systems change is quite a challenge. But we have started thinking, just because of some of our footprint and our particular skills, less about kind of higher level policy change, but how do we think about behavior change of service providers? And for World Vision, that's particularly tools like we have something called Citizen Voice in Action. That's essentially like a community mobilization and community advocacy promotion tool so that they can try to start to hold local service providers accountable.
Okay, I can go next. So again, I'm Genevieve. I'm with Litzel on the SATO team. Little nervous as this session has gone along because all of my remarks and really from how SATO addressed the solution as we focus a lot on the user. We haven't made it as far yet to, I think, really touch on how we might offer solutions for service providers, but I have a couple of points that I can share. Again, looking at these challenges with behavior change in urban settings, from a user perspective, from SATO's perspective as having a specific suite of products. And I hope that the principle may be broadly applicable to other behavior change, kind of the interventions with service providers and that sort of thing. So one, as Ben kind of touched on, so SATO, we manufacture a specific product. I have a little blue SATO pen that we're kind of most well known for. And that is based on a fundamental belief that you need to have a product to for these behavior change interventions to be successful, specifically within the space of sanitation. We also believe that for sustainable use and maintenance long-term of these products, for these interventions to stick, that we need to have market systems delivering these products. So I'm going to spend a lot of time. Sorry, to take a step back in terms of the key behaviors we would think about, it's purchase, it's use and maintenance, and then it's emptying. And I'm going to focus a little bit more on the purchase, but the principles then would apply to use, maintenance, and emptying as well. And so I would say at SATO, we approach this in two ways. One is motivating purchase. And I think the example that Mike was showing in Indonesia, which is really like robust, high quality marketing and branding campaigns is one way that we do that. I think it's really important to consider what a lot of more kind of traditional marketing spaces may talk about, like the rule of 7, which is that you need 7 kind of touch points of awareness before you can expect a person to take an action, in this case, purchase a product. So really kind of blasting them from all those different channels, but also recognizing that, just one conversation is not going to be enough to drive behavior. Also, of course, meeting customers where they're at and in urban settings, making sure that we're catering our channels appropriately. So in rural areas where radio may be more appropriate, in urban areas, it may be digital media, wall branding in high trafficked areas. And then also, in addition to motivating the purchase, we have a strong effort on removing barriers to uptake. And so we want to make it as easy as possible for someone to purchase the product. So that includes keeping costs low so that affordability is less of a challenge, but then also making it easy to install, whether that's by the household or by a mason, easy to maintain, easy for someone selling the product to transport it into these environments. Making it lightweight and stackable ensures that we can get products closer to our users, so that then when they are ready to make a purchase decision, the product is nearby. They're not having to trek really far to a retailer or what have you to get it. As I mentioned, so in terms of behaviors, we have purchase, use, and maintenance, and then emptying that we're focused on. Use and maintenance and emptying, this is where SATO really relies on our partners, because we design a product and we can design branding and marketing, but we are not the implementer that's interacting with these users and service providers day to day. And so I bring this up, one, just to say what we're trying to do is ensure that at the point of purchase, when someone has decided to acquire products, we've kind of embedded what we can within that product and in that process, such that then they continue to use and maintain it. So it's a durable product so that they can actually use it for years and years to come, which facilitates that behavior. And then with emptying, which is where we're kind of newest, I would say, in this space, I would just touch on how we approach the product design part of this to facilitate the behavior, which is we've designed like a pit liner product, which the idea being that it's easy and quick to install, so that installing the pit is less of a challenge or a barrier to uptake. In urban settings, this is not appropriate for all of them, but where possible, we make sure that we have products that allow you to put the pit anywhere around the latrine, so that you can work within different space constraints. We have like a 360-degree kind of Sato adapter. We also have different diameter options to consider different space constraints. And then also in terms of from the user perspective of the interface, but also how this affects emptying is we consider things like the diameter of the hole in the Sato pan being so small that it is big enough for the waste to go in, not so big that it can fit large pieces of trash that would be larger than the diameter of the pipe being used or the tube for a section for emptying later. So again, making it easy for users, but then also kind of in some cases preventing some of the behaviors that we might not want. I'll stop there. Sorry.
Thank you.
That was a lot.
No, that was great. I think you answered the other question that I had.
I might have.
Apart, but that's good. Would you like to?
Yeah, I think on my side, what I can say is the using theory, behavior change theories to inform designing of interventions. I think that's what is most being used at the moment. Because what you need to understand is the context. So for us to understand the context, we really need to have theories to inform us doing that. And our key focus is at looking at the service providers, like the pit emptiers. Okay. So the pit emptiers may need to create demand for their services. The customers they need to see a need for them to demand for services from the pit emptiers. But for that to happen, then we really need to be well organized for the customers' demand. I can give an example of a customer maybe in a very urban setting where we don't have enough space for pit latrines. But if there's no proper demand creation towards the customers, you'll see that the customers may want to dig another pit when the one that they're using is full. They may not see the need maybe to empty this particular pit. So there's a need to create demand so that they should see that need. So for that to happen, there should be maybe various ways of creating awareness. The service providers may need to create awareness to the customers. And this should be for one to understand what kind of awareness needs to be provided. Then it has to be participatory. We need to hear from the customers themselves. What can be the best way for us to create demand for these particular customers? But also, we're looking at the various touch points to be used. Where can we meet these customers? Because that's very important. Sometimes you may want to say that we use maybe radios in the communities to create awareness, or we may use a public van, but is it really effective in a very urban setting? So that's another thing that may need to be understood. But so the issues of queues for reminding the customer that it's their responsibility to demand. He was talking of posters or maybe other ways of reminding the customers. But what we need to look at is the queues that are more participatory. We need to engage the customers rather than just giving the posters that they will read the posters on their own. Others will not even pay attention to the posters. So it should be something that is participatory indeed between the customers and the service providers. And on top of that, the policy holders themselves. It's quite important.
Thank you very much. I think we've had a really great combination of theory, practical application, from a sort of hardware perspective and also from the software perspective, from the responses so far. Maybe Lusungu, can I bring you in now to also answer the question from a implementer's perspective on what other kind of urban sanitation related behaviors you're trying to address, and they don't have to be ones that you've already addressed. They can be ones that, you know, we still need to work on in future. By the way, we can't see you, so you can switch your camera back on. But maybe you were a little self-conscious to be the only one online.
All right, so if you allow me, because of my poor network connectivity here, I will not switch on the camera. Is that okay?
Yeah, absolutely, no problem. Go ahead.
Okay, thank you. So I'll just quickly share some experiences that we've had under the Lusaka Sanitation Program. I like what the previous speakers have shared. But in the area where we've been working, one of the areas that we've worked in peri-urban areas, that is Kanyama and Chaisa compounds. So in these areas, especially Kanyama, I think we've had experiences where the practices where the people in Kanyama have used what is called the flying toilets over a long period of time, and also the type of pit latrines that have been used as on-site treatment facilities over time have not had a groundwater protection feature. This is an area which is quite rocky, and so the pit latrines that have been used in the past years have posed a danger on groundwater contamination. So like the previous speaker said, as we went into these areas as part of the project implementation activity, we did create in forms of communication where we distributed IEC materials so that we can try to adequately create demand. So the approaches that we used mainly focused on communicating with a targeted community or people that are living in these areas, showing them the need or the reason why they have to get connected to the public sewers that were constructed. But also in areas where we couldn't provide sewer sanitation, we provided for improved pit latrines. But as we took this project initiatives, I think we faced a lot of resistance from people because of the previous practice. Some people have never used a flushable toilet or even just an improved pit latrine. So these pit latrines that have been constructed called the improved pit latrines, they've had a groundwater protection feature, and over time, when they're used for a period of about 3 to 5 years, or immediately they are full, these pit latrines can be emptied, thereby providing support to what is called the sanitation service chain. And so this in and of itself has created employment on the pit emptying side, but also on transportation. And also we've constructed 2 fecal sludge treatment plants under the Lusaka Sanitation Program so that we can safely treat whatever is being emptied from the pit latrines and safely transported to fecal sludge treatment plants. To market the project activities quickly from my side, I think we've had to carry out community awareness programs through radio. Of course, it wasn't very effective, but what has worked so well on this project and to effectively engage customers is through the utilization of community mobilizers. So community mobilizers were picked from the community, people that are able to deliver and distribute IEC related materials, and also bring the message home and tell the local people they live with why they need to accept or accept the improved pit latrines or get connected to the public sewer. So through the support from Sophie, who is leading this session, and also other partners that came on board, I think we've had a number of interventions, and this has contributed largely for us to achieve our project development objectives. So I think for now, that's all I can say, but maybe just lastly, to add to this, to some of the challenges that we faced or the barriers, is that in these areas, we've had people that have opted to vandalize or dump their solid waste into the sewers, and also dumping the solid waste in the pit latrines. So through adequate or continuous engagement with people with such practices, we've seen some kind of an improvement in terms of the reduction in terms of the number of blockages that are occurring in that particular area. On the fecal/treatment plants, if solid waste is dumped in the pit latrine, the impact is mainly on the treatment plant, because then, as you may be aware, the characteristic of fecal sludge, of course, it varies from time to time, but it has high solid content. So the generation of solid waste at the fecal sludge treatment plant is quite on the higher side. So this continues to pose a challenge on the utility, thereby increasing operating costs, but with adequate engagement of targeted customers, or in these peri-urban areas, I think we can achieve quite a lot, and also providing alternative sources for them to dump their solid waste and not in the public sewers or in the pit latrines. So this has been an experience. We've had a challenge of tracking and monitoring the impact, but for now, what we're using is the number of blockages and also the type of fecal sludge that is being dumped at a fecal/treatment plant. Thank you.
Thank you very much, Jasundu. That was a really complete kind of overview of the different activities, both on-site and in sewers. And I think what you mentioned there in terms of indicators brings us quite well into the next kind of question, which I want to direct to Ben, Ben is sitting too close to me right now. So, but no, I mean, it's relevant actually to what Jasundu just mentioned. So he talked about the indicators, the relevant indicators. So I guess my question to you, from also kind of doing some of the research angle, I know, and I think the same question I can ask also to Kondwani. So how can we build in monitoring and evaluation to these behavioral interventions so that we know their impact, not just at the end, you know, as per a sort of traditional impact evaluation, but also along the way as they develop?
Sure, thanks. I'm not sure if Kondwani and I are both answering. Maybe I'll assume that he's going to talk a little bit more about the behavioral intervention development and formative research, like he was talking a minute ago. From World Vision's perspective, we're often talking more about translating across contexts and sort of indicators we would need in that case. And so I'd say two things there. One is that we want, I suppose, robust but parsimonious theories of change. So to understand what is the intervention, what is it actually doing, what are the components, and behaviorally, what do we expect them to do? Not to list every single thing that we think is happening. There's often, dozens of activities happening, but the sort of parsimonious is the kind of key behavioral ingredients. And to try to identify how to monitor the rollout of those in new contexts, and to identify which of those are most susceptible to differences in context. The sort of disgust reaction to seeing PCs is probably a universal human behavior, but how a utility might be structured, or regulatory agencies might be structured, obviously, might vary quite a lot. And so, we want to identify those key things, and then we want to make sure that as we're rolling out interventions, there's a sort of, I don't know, honeymoon period, or maybe that's the opposite of the term I'm thinking, a sort of early on period where we're monitoring not just sort of output and outcome indicators, but really carefully looking at some process indicators that we think will predict success. So we might have a program that's going to look at getting groups of community members together to meet, and that would be pretty contingent on whether or not they're actually having meetings for success. But sometimes in areas we'll find, well, the time of day that we were meeting in one place is really not relevant for another place. And just with the most obvious kind of low-level process evaluation kind of metric of, are the meetings happening, we'll see very quickly that that's not occurring. But if we're not intentionally looking at what are those kind of key drivers, we will miss that. And I will say that some of these, it can be challenging and expensive to collect some of this monitoring data. This isn't, there's a lot of trade-off here, which is why I'm talking about like parsimonious models, not just everything you could monitor. But a lot of this can be done in less formal systems than, say, what maybe your like kind of rigorous standard M&E. It's going to be reported every month. It's going to be held to a certain standard. This could literally be check-in phone calls, with people delivering interventions that are kind of taking quick notes, like, tell us how these 3 things are going. And it's going to be really obvious where some of those are failing.
Thank you. Yeah, and Conrad, do you want to come in on that as well? I think I originally was going to ask you more also about the literature kind of coming out of behavioral science and what are the areas where there could be more applications, but you can also respond on this question if you like.
Yeah, I think just to add on what Ben has said, it has to go back to the policymakers and the policy holders, okay, when it comes to issues of monitoring. So there should be deliberate policies to support such kind of arrangements. The policymakers or the holders should be able to monitor what is happening in their respective areas. They should be able to follow up with the service providers like the pit employers, the landlords who are owners of maybe these houses and toilets. How are they responding to these needs? But also they should be able to engage or monitor what's the response from the customers themselves. That's what is required. And this kind of monitoring should not be in a way that fault finding per se, because sometimes when you have someone who is like a monitor, is like maybe an inspector or someone, people have a negative attitude towards a particular inspector, maybe an inspector from the city council. It shouldn't be like doing it in that way, but it should be more participatory, whereby the monitor or representatives from the city council should engage the service providers, should engage the customers in a way to learn how are they progressing with all these interventions, what challenges are there, and how can we improve. That it should go towards that rather than trying to find fault and then trying to say you're not doing well in a way. It doesn't work well in behavior change. And maybe in terms of literature or in terms of research, it's more related to what Robert was talking about, whereby we require more research in this area. And more research has been done, maybe focusing much at the household level, maybe more to do with the toilet cleanliness. But we don't have much research in relation to the pit employers as service providers. So we may need more information on that, but also research that may want to target the policy holders or the policy makers. How can they be engaged in this process from the behavior change perspective? That's something that is still lacking in them.
That's great. Yeah, thank you for bringing the lens out as well and incorporating policymakers in that, and also bringing our attention to some of these kind of urban sanitation specific challenges, like to do with the fecal sludge emptying as well. I don't know if either Genevieve or Lucinda, you can come in with any thoughts. I'm also aware that we've got coming up to 10 minutes left, and I want to give anyone in the room an option to come in with any comments or questions. So if you do have one, then please put your hand up and then we can come to it after Genevieve and Lucinda.
Yeah, sure. I just might add, kind of building off of what Ben was describing around monitoring and thinking of parsimonious models. I've never used that word before.
Great word.
But I think that speaks to something earlier on in the intervention, which is making sure our interventions are very simple. And both, I think, thinking about as organizations that we don't try to do it all. And, we bring in expertise when we need it or partner as we need to, but then also when we speak to our users or our service providers, we're keeping the ask quite simple. And I think, we talked a little bit about in urban settings and time being limited. It's really also just, what is feasible to convey when we think about changing behaviors. And again, kind of tying this to the perhaps private sector or SATO perspective, when we think about marketing efforts and driving a person to take action, to make a purchase. And in this case, perhaps, you keep it very simple and then you have the system in place to do the rest. So when it comes to pit emptying, it's just call this one number. And then if I can just get you to call this number when your pit is full, then the rest can take place. It's not, please, here's a long spiel about the importance of pit emptying and the importance of I don't know, maintenance and but rather just call this number when your pit is full. And I think that is a little bit like that example again from Indonesia, and keeping it really, really simple and trying maybe to do less well. both as organizations and in terms of specific behaviors.
Yeah, thanks. I like that that contrast you're making between kind of giving everybody all of the awareness message and then just sending a reminder effectively is kind of what we do with a lot of nudges and behavioral interventions as well. Listen, do you want to come in at all? I think another question I'd quite like to ask you, which you mentioned may not be prepared for, is around like the characteristics of interventions that you think might be more likely to succeed. If you have any thoughts on that, otherwise you're welcome to just kind of add to the discussion that we were just having.
Yeah, thank you, Sophie. I have not much to say, but maybe one thing that has worked from our side as we carried out this project is using the community mobilizers, like I earlier said. We've also worked with community leaders who have helped us disseminate information to the targeted beneficiaries of this, both non-SWAT and SWAT sanitation. And I think the door-to-door engagement with the landlords and also the ones that get to rent these household, the houses, I think it's proved to be very helpful. And also the other barrier, I think someone already talked about it. We've allowed for customers to pay over a long period of time of not more than 36 months. So the sewer connection fees, or even just the pit latrines, the improved pit latrines, customers were allowed to, Lusaka Water and Sanitation Company would build a toilet, then you pay for a toilet over a certain period of time of about 6 months. So we've made the sewer connection fees on a lower side, but without adequate engagement of the targeted community or the targeted beneficiaries. If communication is poor, I think we noticed that there were gaps like Sophie presented in the earlier presentation, simply because we did not effectively engage these customers. But after engaging community mobilizers, we've seen a stability and also how the response has increased in terms of people responding to these services that are being provided. So in terms of interventions from our side, I think the approach of using community mobilizers, I know communities or countries, different countries have got different setups, but what has worked in Zambia on the Lusaka Sanitation Program mainly is the utilization of community mobilizers. Thank you.
Thank you, Lusingu. I think we have one question from the audience.
I was going to say it's more of a comment than a question. So for the last 5 years, I've been working to evaluate the Lusaka sanitation program in Zambia. And just to echo what he's saying about the characteristics of interventions that work, and community mobilization from the qualitative interviews that we conducted in households was the one thing that really motivated them. But I wanted to add a point that as we know, with behavior change, that knowledge doesn't always translate to behavior change. And one of the main challenge or barrier that we noticed on the qualitative interviews that we did with households was that because of the water shortages, their septic tanks were usually blocked. And that meant a huge cost in terms of maintaining that septic tank. And so households were not motivated to have more septic tanks. They actually were, there was a high interest in connecting to the city-wide sewer, because it was like more of a one and done thing. I connect it and then it goes through the sewer network. I don't have to worry about the emptying the pit or anything. At the time, unfortunately, the connection had not reached in the 2 neighborhoods that we did the evaluation, but more than 90% of households that we spoke to were saying they were ready to connect, and about 50% of them already had like the water pipe connection that was meant to connect to the sewer network ready to go. So there was a lot of like interest and a lot of like the community mobilization strategies that he was talking about really worked, and people were eager and ready to go. It was just there were a lot of barriers, and there was some issues with equity, and because the people who were not planning to connect or who were not yet ready to connect were mostly renters who had no idea about what their landlords were planning for, particularly renters in poor households.
Yeah, thanks so much. I think like all of those dynamics that you touch on have kind of come through in quite a few of the comments in the presentations as well about the complexity of these urban systems, the landlord tenant dynamic, the fact that it's really important to recognize the context and actually talk to people. And I think sometimes we get a little bit too absorbed in these kind of fun econometric evaluations and we don't actually go and do the qualitative research, which also really helps to give you that context specific information about why people are not engaging in behavior that you would want. So yeah, thank you for that as well. I'm going to hand back now to Andy because we only have like 2 minutes or something.
2 minutes left. Well, give the panelists a round of applause, please. So just well, I offered at the beginning, does anyone have any 1-sentence highlights or insights or takeaways that they'd like to share from this session? I have a few. Okay, I'll go. Anyone? Okay. So we heard, I mean, one of the big ones from a research perspective is that, and we heard also in the panel, is that with the literature currently only focusing on the user and the shared sanitation, that there's a lot more research we need around service providers and the rest of the sanitation chain. In terms of specific behaviors, we were talking about holding service providers account. That includes proper disposal, hygienic emptying, proper latrine installation. There's so many behaviors that service providers need to be following, but that requires also standards to be agreed and published by authorities. With hardware, hardware can be designed, but they also need to be well maintained. And with septic tanks, we also heard they can become blocked as well. So there's technical aspects that are barriers for people to doing the right thing as well. With software, there's pit emptiers can be well organized and have customer reminders on their obligation and making it easy to do the things like unblocking and there's places to put the solid waste, which we heard about in Lusaka. That's one of the biggest issues. With indicators, we talked about height and specific parsimonious indicators of customers, landlords, service providers done by authorities to collect that information, but also we heard that in a participative way, so through community leaders to have a real involvement as well, especially in Lusaka here in that community mobilization works really well. So participative collection of that data as well, but keeping it simple, not trying to say do everything, but just say bonus number as well. That's the ask, and that's how you can get some good behaviors. And it just reminds me of some of the work I did with Unilever, and they had their 5 levers of change, which is about making it understood. So making it simple to understand, making it easy to do the behavior, making it desirable, like you really want to do that behavior, making it rewarding and making it a habit as well. So there's all these things that we can use and bring into the sanitation sector in the urban sanitation case to get service providers doing the right thing, users to do the right thing, landlords and community leaders as well. That was a final reflection. Thank you very much to my colleagues for reading as well. Thank you, everyone. Thank you.
I have to. I went wrong. Oh, yeah.